We, the citizens of the world, have a few important questions for you. Why did you not prepare world leaders for this pandemic? In 2015, Bill Gates, in a now famous TED Talk, warned the entire world about not a what if, but a when. Do you all believe yourselves to be smarter than Bill Gates? You leaders are being put on notice. Just because your own citizens are complacent or compliant or fearful, do not think that the rest of the world is not watching. You citizens of Hungary, Britain, the Philippines, Jordan, Kenya, South Korea, Israel, Brazil, Thailand, Chile, Bolivia, of course many others, and especially you, China, you leaders have been effective in taking away freedom in the name of added safety. Citizens, do not let fear allow you to give up your freedoms. These measures are draconian and have no place in the 21st century. Do you think, for instance, it's okay for a Southeast Asian country to threaten to arrest joggers and shoot quarantine violators? What was the reason that almost every country on every continent was so slow to react to the news of COVID-19? Then upon taking action, why were you intentionally or ignorantly motivated to lead with bad decisions and knee-jerk reactions? Or in the case of the WHO, United Nations, European Union, and United States amongst others, drag your feet for so long? Or how about most of the developed world? Why did you promote or allow the spreading of misinformation? Some of you even allowed travel to and from China well into April. And if the real goal has been to keep people separate, why have so many of your decisions resulted in numbers of people being forced into quarters so close, people are practically climbing on top of one another? Are you intentionally devising cures that are worse than the disease? People are dying around the world as a result of lockdowns, starting with the lack of access to healthcare for conditions such as heart disease and cancer. Did you forget about drug addicts locked inside their houses who may die from the sudden withdrawal of drugs and alcohol? How about the increase of domestic abuse victims or families not having enough food to feed themselves, or those without access to clean water or enough money to keep the heat on in winter? And when will the lack of access to mental health treatments and medications and the implications of a lockdown on those with mental health issues and disorders be addressed? How about the increase of depression and suicide, not to mention the academic regression of our children? Who decided to shutter in citizens in third world nations with limited access to food, clean water, and sanitary living conditions? And why, in developed nations, are you ignoring the plight of the homeless? I think that we thought the one good thing that might come out of this would be the slowing down of warring nations, or bringing opposite sides of the political spectrum together, or keeping members of the European Union from taking personal jabs at each other, or maybe the UN intervening as nations fight to come out on top as leaders of this brave new world. Man, were we wrong. Do you think it's fair that the medical community is now having to decide who gets to live and who gets to die due to your lack of planning? And are you also cool with the endangering of the lives of all the heroes of this pandemic by denying access to the very tools they need to protect themselves and to help slow the spread of this virus? And what would cause you to adopt lockdowns, stay-at-home measures, and isolation methods, knowing that they cannot be lifted without second, third, fourth waves, and so on? Why is it that you continue to deceive the public about the effectiveness and how long they must continue, all while destroying the global economy? We're not stupid. Of course, if we stay home forever, we can keep the virus at bay, but a life without freedom is not a life most of us would choose or will choose. By the way, could you tell us how Sweden, without putting the country in lockdown, has been able to sustain far fewer infections and deaths than their close neighbor, the UK? Could it be that lockdowns possibly are the complete wrong approach? And how am I, a complete nobody in this situation, so sure that the lockdowns don't work? Am I wrong? Hopefully. Do I seem smug? Possibly. But it's because the little bit of data coming out of China right now shows that despite having the most draconian and longest lasting lockdown on the planet, their numbers are now on the rise, growing every day. And other countries have experienced similar outcomes. And if you don't think that China's lockdown was stringent enough, I don't want to know what you have in mind, because I'm not sure what's more severe than padlocking a child inside of a house with their own dead grandfather. And I'll pause the narrative here for just a second to tell all of you, I do hope that I'm not right. I hope this virus is unlike any that's come before it, and if we stay in our house for a month or two, it will all go away. I can assure you that I'll be ecstatic if I'm wrong, and this video is a waste of my time and your time. But I digress. Why are government-appointed doctors and scientists continually delivering wildly varying mortality rates when there's no scientific way to currently determine an accurate mortality rate? The US National Library of Medicine National Institute of Health confirmed in 2019, after the involvement of 31 countries and a decade's worth of data, that in order to calculate an accurate mortality rate for just the common flu, they need to collect more detailed mortality data from a larger set of countries over a longer period of time. And why are you, the CDC, okay with the possibility that flu and pneumonia deaths are being lumped in with COVID-19 deaths, while at the same time only reporting the number of infected as those that have tested positive, knowing full well that there are not nearly enough tests to go around? Do you think that we don't know that this underestimates the number of infected and artificially raises the mortality rate, allowing big media to run rampant with apocalyptic headlines in order to grab as many clicks and as many shares as possible? And speaking of the mainstream media, are you afraid of what will happen if you reveal that obesity is playing a major part in who lives and who dies? Don't act like you don't know the answer as to why the mortality rate differs largely from country to country. Is it a less sexy headline if you talk about smokers, alcoholics, drug users, the poor, pollution, inadequate medical facilities, and health issues, all contributing to a country having a higher mortality rate? Oh, and I almost forgot to include your ridiculous vaccine timelines. The fastest vaccines to ever be released up to this point in history have taken years to develop and be made available to the public at large. We hope that this vaccine is produced in record time, but there won't be one this year and probably not next year, so stop using empty promises to brainwash people into hiding in their homes. And can you remind me again, World Health Organization, why you've continued to freeze out Taiwan?
The WHO considered Taiwan's membership. Hello?
I'm sorry, I can't hear. I couldn't hear your question.
Okay, yeah. Let me repeat the question.
No, that's okay. Let's move to another one then.
Right, because I'm actually curious on talking about Taiwan as well, on Taiwan's case.
We decided to give Dr. Alward another call to follow up.
And I just want to see if you can comment a bit on how Taiwan has done so far in terms of containing the virus.
Well, we've already talked about China, and when you look across all the different areas of China, they've actually all done quite a good job. So with that, I'd like to thank you very much for inviting us to participate, and good luck as you go forward with the battle in Hong Kong.
Never mind, I just remembered. It's because as an organization, you've been corrupted by China. That's too bad, because as of writing this, Taiwan has only 388 confirmed cases of virus and only 6 deaths, despite having a dense population of almost 24 million people. You would almost think that there's something you could learn from them. But what do I know? Oh yeah, I do know something. I know that Taipei warned you of human-to-human transmission as early as the end of December, but you failed to act until January 20th. And now we've arrived at China. China, China, China. Why did you build a fail-safe system after the devastation of SARS and not enact it at all upon the discovery of COVID-19? Was this due, as reported by local doctors and officials, to the fact that the initial physicians were too fearful of repercussions from government officials? In addition, were doctors and lower-level government officials not silenced by whatever means necessary at every level? And more importantly, do you think at any point in the near future, while it's still helpful, you'll share your real case and death virus numbers? Yeah, we know you're not the only country lying, but your numbers seem particularly important to us if it's all the same to you. And just why are wet markets continued to be allowed to operate, despite there being plenty of logical and deadly global pandemic causing virus reasons for closing them? And hey, rest of the world, any idea what China is up to right now while we're all completely distracted? It's not much really. They're just trying to reshape the entire world order and assert themselves as the leaders of the not so free, but hey, at least horrible new world. And why do the Washington Post and other news outlets around the world continue to promote the idea that it would be economically infeasible to protect the vulnerable, while allowing the rest of us, the less vulnerable, to continue to live much closer to normal lives and at the same time still keep the economy afloat? How much of that US stimulus package was being used to bail out the private airline industry? 50 to 80 billion? I'm starting to think maybe the airline should be a socialized service. Please do not tell me that there wasn't enough money to protect the vulnerable. That is the saddest, funniest thing I have ever heard. And also, out of touch traditional media, where do you get off running with sensationalistic headlines that whip the public into panic and frenzy? Do you not understand the suffering that is already taking place? Is your relevance more important than public safety during a global pandemic? Google, Facebook, Twitter, Apple, y'all probably thought I forgot about you as well, but in between developing tracking apps, working towards integrating core functionality that will all but do away with privacy in the modern age, and banning posts and comments that go against your own political biases and narratives, we have your number too. You remember, right, that it's you that needs us and not the other way around. Oh, and I'll throw in a couple of dishonorable mentions just for fun. Hi, Indonesia. We were just wondering what you're currently thinking, misleading your people by misdiagnosing their illnesses as the common flu, bronchitis, or even acid reflux instead of COVID-19. A quick internet search reveals that in just Bali alone, Chinese people, obviously including Chinese people from Wuhan, make up 25% of your tourism industry. It's all right if you can't do the math on the probability of your numbers being made up, but we can. And how about you, Bolsonaro, the president of Brazil, insisting that COVID-19 is a hoax concocted by your enemies when members of your own cabinet have tested positive for the virus? How were you able to ignore your people to such a large degree that local gangs had to step in and do your job by enforcing curfews in order to protect their own neighborhoods? And as I know your time is valuable, world leaders, I'm only going to highlight some of the more egregious moments from the COVID-19 Wikipedia page. Why did it take until December 30th for information to come out in the form of leaks on social media? Why was the incredibly brave and now deceased Dr. Li Wenliang threatened and silenced by the Chinese government for spreading truths about the coronavirus? Why on January 9th did the WHO report that the Chinese government had acted swiftly when they knew that they hadn't? Why did China publicly threaten lower-level officials not to cover up the spread of the virus while actively covering up the spread of the virus? Why on January 27th was Gabriel Young, Dean of the University of Hong Kong Medical School and one of the foremost world experts on SARS, ignored when he projected that the true number of infections was likely 10 times what was being reported? And why did it take until January 30th for the WHO to declare the virus a public health emergency of international concern? And why did Joe Biden feel it was okay to label the President of the United States a racist for enacting a China travel ban that very same day, a statement he has now had to walk back? And finally, because don't think you're remotely off the hook, why did you, President Trump, take until mid-March to finally start taking this situation seriously? Yes, actions were taken, but they were taken amidst a massive campaign of misinformation, all the while the pandemic raging around us. You may not have been given the months of December and January to act, but I'd like to see you explain away February and March.
As regards the masks, I believe that everybody knows that masks save lives. The idea of hospital administrators abusing our physicians and nurses makes me apoplectic with rage. The fact that these people are told that they can't talk to the press and they write to me and their family and their children write to me. My mother was asked to do this. My uncle works in a prison. He's not allowed to wear a mask. He's not allowed to bring a mask. I send a mask, blah, 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 blah. What the hell is wrong? It is time for these people to resign, and it is time for us to remember that we have the ability to turn over our own government.
So it turns out that masks are the hill that I choose to die on. Metaphorically, of course. I guess I was fortunate being in Asia during this crisis. I had access to good information early on that revealed that masks could help to prevent you from contracting the coronavirus. There was plenty of reliable science all around us, but really, isn't it just common sense? Do you mean to tell me that you believe that these masks that prevented the virus from getting out weren't able to prevent the virus from getting in? You're better than that. And if you aren't, now's the time to start. Okay, let's play devil's advocate for a minute. Suppose that with the $17 billion combined budget of the WHO and the CDC, that it's reasonable that it took them 4 months to figure out that masks help slow the spread of the virus. Let's even imagine a world where masks don't allow the virus out, but they welcome it in. Now think about this. If you and I were both wearing masks and one of us was sick and one of us wasn't, I'm not sick by the way, how would it be possible to infect the healthy one of us? It would not. Even if the masks only kept the virus in, if everybody wore them, then it wouldn't be spreading. At least not nearly as close to the numbers we're seeing. There's literally no way to look at what they said and not call it a bold-faced lie. So, I have loved ones in the state of Maine, and at the same time that I'm finding out that masks are imperative, I'm learning from them that either they're not available, people are being told that masks don't offer protection, or that folks have been outright banned from wearing them in the workplace. I ship my parents some masks anyway, and I tell them wear them at all costs. But none of this is making any sense to me. I know that Hong Kong health agencies took the stance on January 24th and mainland China on January 31st that everyone should be wearing a mask in public. Dr. Fauci on January 22nd talked about transmission through droplets. Then American Lung Association Chief Medical Officer Dr. Albert Rizzo said the wearing of masks by all individuals can give some degree of barrier protection from respiratory droplets that are coughed or sneezed around them. On January 23rd, articles printed in major newspapers in the US talk about the importance of healthcare workers wearing masks. So maybe that's the trick. Masks must only work for medical professionals and not the rest of the general public. On February 29th, the US Surgeon General, Dr. Jerome Adams, tweeted that masks do not offer any benefit to the average citizen. Again, magical masks that only work for healthcare workers. Then the CDC contradicts themselves on March 24th in regards to the effectiveness of N95 masks versus homemade masks. George Gao, General Director of the Chinese Center for Disease Control and Prevention, on March 27th, warned not wearing masks was a big mistake in the fight against the virus on the same day that Professor Kim Woo-ju from Korea University Guru Hospital issued the same warning. Yet shockingly, on April 8th, the CDC is still pushing the idea that masks offer very little protection. So, why all the confusion? Liu Shi, who researches comparative health systems and health policy at Johns Hopkins University, said that governments should not have downplayed the importance of face masks as a protective measure for the public, because it will make them seem very foolish when they change their stance again and again. So here's the deal. I know all of this information because I read a disgusting article by Fisher Phillips that was posted to their website on February 24th that reassured US employers that they had every right to deny their employees from wearing protective face masks. It enraged me to know that my parents' health was at risk, especially as my mom was working at a nursing home and was being forbidden from wearing the mask that I had shipped to her. On April 1st, after reading Fisher Phillips' article, I contacted every local major news outlet with this information. I informed them that the White House was about to announce that citizens should be wearing masks and that essential workers have no recourse if an employer stops them from doing so. I also told them that my mother was working at a nursing home locally and that although she would be someone considered vulnerable, she was being forbidden from wearing a mask at work. I was laughed at or I was ignored. Again, another nail in the coffin of mainstream media. Your government's lied to you. I'd love to give them the benefit of the doubt and assume that they lied to you so that the masks went to the people who needed them the most, the healthcare workers. But seeing as that wasn't even happening, I'm not sure what conclusion any of us should draw. Did they lie to us because they didn't trust us to do the right thing? Just because some of you guys went out and bought up all the toilet paper, now none of us can be trusted to do the right thing? The deal is, they were unprepared. Most of the world was unprepared, even though the world leaders had been warned many times. They knew we were in short supply, so they just told all of us that masks don't work. How does that make you feel? Hi everyone, I know that right now things are tough, but we really need to start talking about difficult subjects. And we're gonna start with the fact that an economic fallout or recession or depression shouldn't be something that we are currently thinking of in abstract terms. I know you don't care about Wall Street or corporate structuring or big business, but when you see headlines talking about what this means in terms of the economy, you should be thinking about feeding your family, keeping a roof over their head, having to find a job in what might end up being the worst economy since the Great Depression, and that likely hundreds of thousands of people, myself included, have lost small businesses that they had poured their blood, sweat, heart, and tears into. And if that still doesn't wake you up, how about not having enough money to bury your loved ones that passed away on account of this pandemic? And these are just the first world problems. One more month of this could be enough to set the modern world back 10 years, but developing countries 30. We're not supposed to live like this. The government and mainstream media have convinced you that these lockdowns are your idea. Facebook going as far as offering a hashtag stay-at-home frame for your profile picture. Why would you even open your windows when the world is facing the deadliest virus in 100 years? I know that there are those of you that are truly suffering right now and do anything to make this go away, but there are also millions of you that are feeling comfortable or complacent right now, waiting for that government check in the mail, confident that in 2 months, these lockdowns will be a distant memory and you'll be working your way back to the way things were. I've seen many people describe this as a forced holiday in which they get to spend more time with their families or finish that project that they've been procrastinating on for 2 years. And why would you pay attention to what's really happening when we can just binge watch Tiger King? This isn't a holiday, this isn't a vacation, but it's also not the opposite of that. For every person that's taking this in stride, there's another paralyzed with fear, ready to give up all of their freedoms in exchange for just making this all go away. The media has whipped you up into an anxiety-riddled fight or flight mode, and fear has displaced the logic center of your brain, and nobody could blame you. With a 24-hour news cycle that is either feeding you deadly headlines, terrifying stats, or just plain misleading information, why would you not accept being trapped in your own homes with no long-term plan for how they're ever going to get you back out again? This is me begging you to wake up and demand another solution. I wouldn't begin to downplay the seriousness of this situation. We're clearly dealing with a virus that may be 10 to 20 to 30 times more contagious than the flu, hence why the medical systems are overwhelmed. However, we're taking a world-altering event and making damn sure that we couldn't possibly come out of this without it having devastated the people of the planet. That said, having seen the protests taking place, I want to make one thing crystal clear. I am not condoning the gathering of people if social distancing guidelines are not being observed and people are not wearing masks. In no way do I want to be lumped in with conspiracy theorists or those that don't understand the gravity of the situation. This is serious. This is real. So to all of the people out there thinking that things can go back to completely being normal, wake up. There isn't any more room right now for added stupidity or for putting your loved ones at risk. I can't feel too bad about how much of your time I've taken up, seeing as that's all most of us have right now, but I will leave you with one last thought. As of 2018, about 32 million people have died of HIV/AIDS globally since the beginning of the HIV epidemic, and the death count still remains shockingly high at nearly 800,000 people dying of AIDS in 2018 alone. Back in the early 80s when the AIDS epidemic started, all it would have taken to eliminate most cases of HIV would have been for people to stop having sexual intercourse. Pretty simple. And yet, what happened to people that suggested no sex as a solution? Well, most of us laughed them right out of the room. Instead, there was a push to use protection. Yes, it wasn't as effective as abstinence. People still die, but that's what we as a society deemed acceptable risk. If you think that not leaving your home for the next 1 to 2 years is acceptable, I'm not the guy to change your mind, but for all of you that are free thinkers, this isn't and can't be the solution. I'm all for the protection method. Let's employ the use of face masks, social distancing, and thermometers in public until we have a better handle on this, and for sure, let's do all we can to protect our most vulnerable. However, I don't know about you, but I'm ready to step outside my front door and stop being afraid. I hope that you choose to join me. You can start by sharing this video on some or all of your social accounts if you agree with the content. I love you, world. Stay safe, and don't forget to subscribe and hit that like button. Thank you.